So right now we're going to talk about the patient chart, um, and especially the left panel. So again, to access to a patient chart, anywhere you see the patient's name, you can click on it and get direct access to the patient chart. So here we have Mr. Alex Carter, and as you can see, the progress notes in the middle, left panel, and right panel here. So let's start with the left panel. So again, you have all these sections. You can fold or unfold all of them. Okay, you can also unfold the whole screen, but let's unfold this one. Okay, so the first section is the demographics. So you have everything: the demographics, the name, the chart number, date of birth, health card number, etc. So, and you even have the picture. And of course, this is not a real person. This is an AI picture, AI generated picture. If you want to change the demographics, you can open the pop-up here, patient demographics. So you have the whole detail and the last update and who did it. And then you want to edit, and you can change whatever you want. So the only things you cannot change: the chart number, will be automatically calculated, and the email, because the email helps for the gives access to the patient portal. Um, then you can change the address, etc. Okay. Uh, then if you want to upload a picture, you can, or you can use the your device's camera to take a patient picture if you have a webcam. All right, it's pretty straightforward. Then we can close this. So each section you can open and close when you click on the title here. Second section, past health. This is pretty much the past medical history. And so as you can see here, Mr. Carter had chlamydia in February 2024 and appendicitis in May 2022. And if you want to add any event, you can click on add right here, onset date, life stage, procedure date if it's a surgery, resolve date if it's let's say an infection, and you could put notes. Okay, so let's cancel this one, close, past health. So that would include, for example, the past medical history and also the past surgical history. Okay, now the family history. So click the pop-up. Uh, just one mention here, like if you have three dots here, that means there's more. Okay? So the overview here, you have the first line, four first family members, but then you have more, and that's why you have like three dots here. Then when you open the pop-up, you see the maternal cousin has a stomach cancer, brother has a melanoma, the paternal grandfather had an MI, etc. Okay, so if you wanna add something, same thing, you can add description. So whatever, let's say lupus, and you choose a relative, and you have the whole list of the most the most important relatives, and then you can free write if it doesn't if you don't find anything that suitable on the list, you can write. Okay, and then the start date, age of onset, the treatment, and notes. Okay, um, we'll cancel, close. Again, it's pretty straightforward. Close the section. Relationships. So that helps basically to see, in your practice who's related to who. It could be helpful for any genetic disease, any family disease, or any household disease, household infection like TB, who lives in the same house, and also sexual transmitted disease or infertility. So you can click here on the pop-up and add a relationship. So as you can see here, Mr. Carter is the brother of Mr. Dubois, Jean Dubois, uh, and well, they don't have the same last name, but it doesn't matter. Uh, and his Mr. Carter is the boyfriend of Mrs. Amber. Okay, and again, you can add a relationship, and you have all this kind of relationship. Okay, the wife, the son, uncle, niece, whatever. And again, you can, if he doesn't, you don't find anything that suits the that on the list, you can add something on your own. Okay. All right. Relationship, alerts and special needs. Whatever you feel that's an alert or a special need. So, for example, here, Mr. Carter would like morning appointments only, and you can add, you know, anyway, you can say, oh, Mr. Carter, always angry. Be careful, be very diplomatic with him, whatever. Okay. And then here, close. Next section, risk factors. So he has alcohol addiction. So that helps you evaluate, what can be for preventative medicine. If he has an alcohol addiction or he's smoking a lot, you can add it here and you can see risk factors. We got to work on this on these. Um, or let's say multiple partners. We're going to work on this, like prevention of STIs, etc. So same thing. You can add what you want. Um, close. Medications and treatments. So this is where you make your prescriptions. Okay. So right now there's no active medication. You click the pop-up, and you're gonna see the list of medication that the patient took or is taking. Okay. So always important to remind us about the patient's allergies. Now these are in gray background because they're all inactive. Okay. So that patient took this in the past, so that's the history. Okay. And then if you click on the details, who prescribe, and then the strength, etc. Yeah, all the details. So this is inactive, and if you can delete if you want. Now, if it's a new patient that comes with current medication that you have to add to the chart, but you don't want to make a new prescription, so you have to add the medication without a new prescription. You just click here, and then you can add the medication. Now, so you just have to put the drug name, the strength, the form, etc. Okay. You need a measure, and as you can see, so there are uh, uh, some things that are really mandatory that you've put with the star. Now, for example, here, route, see dental, contact lens, disinfectant, intraamniotic. So there's everything. If if something doesn't, if something is not in the list, you can just free write here, write a freehand. Okay. Now, if you don't have you can just write the whole thing, or you can just use a template. So template, this is the list of drugs, uh, the most common drugs used in Ontario. So use template, and here you have the whole list. Now, there's a lot. Then you can search, for example, captopril, captopril. And here you choose the one that the patient takes. Click on this one, and it just populates here. Start date here. It's oral. So this is pre-populated. Frequency it's once a day. Duration. So that was like for 6 months. So year. This is year, month, week, day. Okay. This is long-term medication. Yes. All right, and this is the prescription, the actual prescription. Then you save. and this is automatically added to the patient profile. So here, captopril, 50 milligram once a day for 6 months, and it's active. Okay. Now, if you want to actually write a prescription, you click on New Rx, and this is an overview of your prescription. As you can see, this is you with the clinic's contact information, the logo, uh, patient, the health card, and a prescription. So as you can see here, you can write like free text in this window, but here for the sake of medication traceability, we recommend that you include medications using either your templates list or the medication form located on the right side, basically here. While you can fill in the prescription as free text, please be aware that doing so will not add the medication to the patient's EMR. That means if you write things here directly, this will not go on the patient profile. So it's better to use this as I showed you earlier, uh, and to make the prescription. So let's do another prescription. So for example, allopurinol randomly, okay? And then so you have the medication, you fill the form, uh, oral here, frequency daily. Let's say we prescribe for 6 months, and that will be so automatically substitutions allowed, long-term medication no, by default. Then when it's finished, and of course there's always patient's allergies to pay attention to that. Uh, then if it works for you, then add to prescription. And as you can see, it's added automatically here. If you don't like it, you can remove it. Click on the trash can here. And then let's add another one. So let's say Trandate. Here, it auto-populates as usual. Milligram frequency once a day. Let's say for 6 months. If it works for you, instructions. If it works for you, you can click add to Rx to have this translated to this page. Okay. Now you have two medications. So let's say that's all you want to prescribe. Then you're gonna have to check. You can check. You can do a preview, and the preview will check interactions and make sure there's nothing you prescribe is here that is an allergy to the patient. It is automatic. Before you're able to print that prescription, the system will check interactions and allergies. But you can check interactions first if you want, and then change it. No. But let's say you're happy with the with your prescription here. Click preview. So that's a preview of your prescription. Okay. With the date, prescription here, your electronic signature. And as you can see here, it's a Calvin AI chat. So that's the AI that actually going to check interactions and allergies. So here, there are no known major drug interactions between allopurinol, labetal, and captopril. So as you can see, captopril was active, so the system took it into consideration. So no interactions. As for the patient's allergy to fish, nickel, and penicillin, there are no interactions with the medications listed. So we're good to go. Then you can close this, and then you can save and print. So save to print later, save and print right now. Save and send, then that means you can external, means send it to the patient portal. And save and fax, you can fax it to your pharmacy, to the patient pharmacy. Okay. All right. And for example, let's do save and fax. So there's going to be a pop-up here for the fax. So new fax. Then you got to choose the pharmacy, and you know that this patient, for example, goes to the Montana pharmacy. Click here. You have the fax number. Prescription is right here. But it's always good to write something for the pharmacist, and you use a template. Let's say prescription here. So we have like pre-made templates for the fax prescription. So prescription attached to medical prescription. Please contact the patient once the medication is ready for pickup. Please feel free to contact us if you have any questions. So we're good to go. Let's close the templates and then you can send. Okay. Here, so we're done. So we click close all the pop-ups. So these are medication and treatments that stores the inactive and active prescriptions, uh, and that's where you make new prescriptions. Uh, Past prescriptions. Let's say you did the prescription, but the patient lost it, and you're a nurse or you're a secretary. You're not able to redo a prescription because you're not a doctor. But all the prescriptions that were made by the doctor are here, and you can just reprint. So for example, this one that I just made is right here. So you can say, "Oh, you lost your prescription. It's okay. I'll reprint it." Print. Okay. And they're stored by date. Okay. So we can close this one. Close this one. Family doctor specialist. This sorry here. So you have the list here of the doctors taking care of the patient at this clinic. So this is in our clinic here. This is Dr. Williams, Marion Williams taking care of Mr. Carter, and Mr. Carter has other doctors working outside the clinic, which are Dr. Griffin, Dr. Mathers. Okay. Then you can change. You can add. Uh, let's say add another doctor. So now external doctors directory. So these are the doctors that are known so far by the system. So if you can add a doctor here, and that name will be available for all the users. Yes, that we add to the database. Okay. Then you close the doctors. Pharmacy is same thing. So this is the preferred pharmacy of the patient. You can change it if you want, or this is These are the pharmacies. Of course, these are fake pharmacies, but these are the pharmacies in the system available to in the directory available to everybody. If it's a new pharmacy not listed here, you can just add it. Okay, and then assign it to the patient. So let's say Mr. Carter was dealing with buying his medication at Montana Pharmacy, but he moved, and now he's in Texas, Albuquerque, Texas. You prefer yes, close, and now it's the preferred pharmacy. Okay, so click here, Texas. All right, so that's the pharmacy. E-forms. So that's where you do your prescriptions, your requisitions. Uh, so just as an example, let's say um, you want to order an ultrasound to the patient. So there are many e-forms. Right now, there's only one. We're going to add more, of course. So True North Imaging, and then you have the requisition form pre-populated by the system with the patient name, the address, the phone number, health card number, etc. And your name, your phone number. Okay. So you just have to add the clinical information and the test you want. Okay, just click, click, click. Easy to do, and then you can print. Okay, and then if you want to keep this requisition in the patient chart, so let's say here, like shoulder pain, you save it with your changes. Save it in the system here. Okay, so it's on the computer, and then you can add it to the record, upload. So it's gonna upload it, and here it is. Okay, with your changes. Shoulder pain, and this is what you requested. All right, so that's the e-forms. Reminders, that's for you. It's just like a reminder uh, concerning the patient. I know here the patient owes $1,000 to the clinic. And of course, you can delete once he pays. You can add another one. Any reminder about this patient. Okay, pretty straightforward. Letters and referrals. This is where you do the. Let's say you want to send a letter or a referral to a specialist. So you click here, add. This is an overview of what you're going to send. Again, just like the prescriptions, this is your information, clinic logo, address to whom it may concern by default, but you can change. You can add to the patient. You can add the patient's name, or you can add here. There's an icon. This is a doctor. This is the small stethoscope, and you have the name of the doctors uh, in the system. So external doctors, um, and the doctors working at the clinic. Yeah, so let's say you want to send to Sunnybrook, colposcopy Sunnybrook, and here it is. It's added automatically. You can write the template, the subject, and you can write freehand or you can dictate here with a microphone. And as you can see, your signature is it's pre-populated with your signature. I'm gonna put the name, letter, let's say July 10, 724, if you want. You could do any name you want. Description if you want. You don't have to. And we, as usual, because we don't want to write it every time, we have a bunch of templates. For example, if you want to send patient to a specialist, um, see you have here refer to a specialist. So you just click and it populates here, and then you can change for what you want. Please see this patient. Dear colleague, please see this pleasant patient for specialist consultation, test and treatment. Reason for referral, you can say abnormal pap tests. Well, it doesn't make sense because it's a man, but anyway, let's pretend. Let's pretend it's a woman. Timing of consultation, so is either urgent, priority but not urgent, as per your availability. All right, that's not urgent, so you remove this. See attached the relevant information and documentation. I'm looking forward to receiving a report of your consultation. So, okay, then you can attach from the patient reports any test result. Let's say this one test report, this one. Let's pretend this one is a pap test result. Click here, and it will be attached to the document. So when you're done, you're happy with it, you do click preview, and here it is. And then again, like the prescription, you can save it, save and print, save and fax, save and send to someone working at the clinic, or save and send to the patient. Okay, so if we save it, okay. All right, it's saved here, and then you close it. So let's look at the letter we just made, the July 10 here. So that's the letter for colposcopy, abnormal pap test, and it has attached the report, okay, in the same PDF. Then you can print it if you want. Okay. Now it's here. If you forgot, oh, I want to refax it, so fax it. I want to resend it, etc. It's just to change the name. Okay. And all the letters are stored here. Okay. And just to show you another what's possible to do, you have appointment certificate. If the patient wants a, I need a certificate to say to prove that I was at the clinic today. Okay, no problem. Consultation report if you're a specialist. Okay. All right. and modify duties. Yeah, here and sick note for work or for school, work from home note, uh, and you can, of course, you can add your own templates. Yeah. All right, and groups. So that refers to the groups that we talked about before in another video, and you know that this shows that Mr. Carter is ranked number 7 in the group called new patients. Okay. So that was pretty much the left panel. And next video we'll talk about the right panel.